We're really, really honored to have Karla Hall come and provide some guidance for parents. We kind of gave her a free wheel on what things that she thought might be most pertinent for families with PHACE syndrome. Most of you know Karla. She has dedicated her life to running a support group for children with vascular anomalies. The most incredible thing about their site is it's so it's just not a selfish place. It only gives, so it doesn't ask for a lot of donations. It doesn't ask for a lot of recognition, but really it is the mission to guide people to get where they need to go, close to home, to get the care that their child needs. And I think that's really a unique and very, very special and effective way to run an organization. So thank you, Karla.
I get real emotional, so I'm going to apologize in advance because that almost got me, and so I'm sure that there will be something in here that will catch me too, so I apologize in advance. I am Karla Hall. I am the mother of 3 children. My oldest is now 19. My hemangioma baby is just turned 16, and I have a 9-year-old. I also have been married for 25 years to my husband Bob, and we are now currently back in Greensboro, North Carolina. I'm very excited about that, to be back there. The organization that we founded, NOVA, has a mission of being a patient support and advocacy organization, and we provide assistance to individuals in the care of the wide spectrum known as vascular anomalies. This includes vascular tumors, vascular malformations, and the related syndromes that include PHACE. Over the past 5 years, I have to say that the greatest area of our growth in our organization has come from the area of support for PHACE families, and it's really because of the parents like yourselves and the grandparents that are pushing and motivating us to work harder and look harder in finding the resources and the information that you need. Likely each of you sitting here can remember that scene where your baby was born. My oldest daughter now is almost 20, and I can see the aquamarine floral quilts and curtains in that room as if it was yesterday. Likewise, I also remember that sinking feeling when you know that something's wrong with your child. Like I said, for me, it was our second child. As I inspected her from head to toe and I counted her fingers and counted her toes, I noticed her hemangioma. And I asked and I questioned, and I was told it was nothing and not to worry about it. No one ever used the word hemangioma with us for weeks. But despite all the assurances, I knew that something was wrong. And it was at that moment that I became her patient advocate. They describe a patient advocate as a liaison between the patient and the establishment of medical and health care. It is a growing profession in the United States today. As a parent of a child diagnosed with PHACE syndrome, this new field, like it or not, is your new career. In your new role, you must educate yourself and other family members on behalf of your child. There will be new terminology, new diagnostic tests, and new medications that you will need to understand. You will need to speak up. I find many new moms and dads that this takes them really out of their comfort zone. They're not used to questioning the medical authorities. Sometimes you will definitely have to speak out. If the procedures seem painful, ask for pain medications. If they are not tolerating the medications that they are taking, ask for ways that they can be given that might be more acceptable to them and make it easier on you. If there are many procedures that need to be done, see if there's a way to get them done all in one day under one general anesthesia. As a parent-patient advocate, you need to remember that you truly are this baby's voice. So the actual job description of a patient advocate includes understanding the medical diagnosis and terminology and being able to explain this to your families. Your patient, obviously, at least in the beginning, is a baby, but your families and your friends are going to want to understand. You need to understand the available diagnostic testings and treatments, how they are performed, their risk versus benefits. It also includes finding and filtering through credible and reliable medical information, finding doctors, specialists, and treatment centers for your patient, and of course, working with your insurance company to get the maximum benefit that is available. Additionally, it is equally, and if not more so important, that you learn how to connect with other families and other resources that are out there. As a parent-patient advocate, you will need to fulfill these job requirements, all while you are remembering that you still are the parent to this patient. This can and will be overwhelming at times. So remember, there are many other parents, mothers, fathers, and grandparents that have gone down this road before you, and I promise you, they're all there, wanting and willing to help and support you down the road. So how do you meet the job requirements of a patient advocate and be a mom or dad or a grandparent too? You need to learn how to utilize the resources that are available. There are internet sites, nonprofit organizations, print media, books and articles, message forums, blogs, and the social networking sites that are all available. For most of you, the first thing you did when you heard the word PHACE was head to the internet, or like I tell my children when they don't know what something is, go Google it. There is a great deal of information on the internet that can be helpful, but also there's a lot of outdated and misinformation, especially in the area of medicine. Weeding through the good and the bad is essential to finding the right medical care for your child. Information sites like WebMD, Medscape, Medline Plus are all excellent places to start because they offer you the definitions, the terminology, the diagnosis, and the treatment information, and it's presented for the non-medical person. So pretty much anybody can look at these sites and get a general understanding of what they are dealing with. What I have found, though, is one of the best resources for this medical information for PHACE comes from the hospital-based sites. Milwaukee, Houston, Cincinnati, Boston, to just name a few, have excellent information not only on the whole spectrum and the criteria for PHACE, but additionally specific to what they're doing at their institutions and how you can prepare yourself for coming for your visit there. On the medical information sites, you will also often see a link to the nonprofit organizations that provide medical information as well. When looking at the support groups and the nonprofit organization sites, you want to make sure that these sites are credible and that the groups themselves are reliable. When looking at these sites, you should easily be able to know who is responsible for the information, the purpose of the online resource, and it should be referenced to where this medical information comes from, and it should be dated. Ask yourself, do I know what the purpose of this organization or group is from looking at their site? If this question is not, or these questions are not easily answered, then you should question the credibility and the purpose of the organization itself. One way that you can do that is to look for certification. Now there's a few of them. I'm most familiar with OnCode. OnCode goes through a website and certifies, making sure that they adhere to 8 principles ensuring medical accuracy, reliability, and that the information is sourced and dated. Our organization received its first certification from OnCode in 2006, and I just found out yesterday that we did receive it for 2010. They do certify you every year, so they make sure that your information doesn't go out of date. Most of the nonprofit organizations also have message forums and blogs, which after you register, they will allow you to communicate with each other and with the organization. Each of these organizations will administer these sites differently and independently. Some of them are very private. They really want to ensure that it's just the families and the patients that are using them. Others open them up to the public and even to physicians and researchers to communicate with each other. The PHACE syndrome community itself has a very well-maintained and semi-private site. You have to apply to get on it. Facebook, with the F, is fast becoming the most effective way to communicate with others about PHACE. Both NOVA and the PHACE community are now using Facebook, along with many of the other vascular anomaly support organizations. I want to take just a couple of minutes to emphasize the importance of protecting your children's medical information and personal identity in this age of digital communication. Please de-identify your blogs, your message postings, and all of your photos. Set your Facebook privacies to friends only for everything. We just don't know the long-term implications of releasing this medical information out there on the internet. Remember, someday these children are going to grow up, and they may not appreciate that every detail of their medical history was put out in the public domain. These forums, blogs, and social networking sites are not your private baby books. They're not your personal journals. Go home, get a notebook, and journal in that. As an advocate for this child, please protect their privacy. Now, there are books ranging from reference material, medical treatment, and inspiring life journey books that are written by parents and patients themselves for vascular anomalies. These are very general information books. I've listed 3 of them that we commonly refer to that can be very helpful. Unfortunately, there are no books specific to PHACE syndrome. I challenge you to get together and put your stories together. What a wonderful resource it will be to the next generation of babies if all of you tell your stories for them to refer to. This example today would be a perfect one that the next baby born would be able to turn to. So, medical care and treatment. Dr. Frieden asked me for the ISPA meeting to see if I can identify the vascular anomaly centers. So we found that there were 37 multidisciplinary vascular anomaly treatment centers in the United States and Canada. This was based simply on information from the center's own websites. And additionally, there were many individual medical practices that treat vascular anomalies. To help you find medical care and treatment, NOVA does have a listing of the vascular anomaly centers and the private practice physicians that treat vascular anomalies. Due to the complexity of PHACE syndrome, NOVA does advocate that all of our families have a multidisciplinary center evaluate and consult with each patient. These VACs allow the patient to have a single appointment with multiple physicians offering you the latest technology, the latest research, as well as a great resource of collateral services for your patients. Most of these centers will work closely. I mean, it hasn't gone by me that there's 37 centers in 2 countries, so we don't all have one in our backyard, and travel will be involved. But if your center will work with your local physicians, then maybe you can eventually reduce the number of trips that you have to take to the multidisciplinary centers. So if it were not enough that you basically had to get a degree in medical information, you now have to work your way through that advanced course and ever-changing course of health insurance. A health insurance policy is a contract between the insurance company and the consumer. It is not a contract with you and the physician. Providers are those who provide medical services, your doctors, your hospitals, your clinics. Providers can elect to participate with the various insurance companies, agreeing to a schedule of fees and services, or what they will agree to charge and accept in payment. The insurance company does determine what medical procedures and treatments are considered medically necessary, and what they will pay or reimburse the physicians. Now, there are two basic types of health insurance plans that I'm going to go over, and those are the HMO and the PPO, and I apologize to our friends from Canada who don't have to deal with any of this, and we don't know what we're going to be dealing with in the future, but for right now, this is what we have. The HMO is the most restrictive type of plan that you will find. The insurance company offers a set list of doctors and providers from which the patients can seek treatment. The plan typically offers a very attractive and affordable premium for both the employee-based insurance plans and the plans you buy yourself. However, if you need to select a physician outside that plan, they don't have to pay anything. Now, you can go through a lengthy process of getting them to allow outside care, but for the most part, they simply don't have to do it. The preferred provider organizations offers you two classes of providers. The first is what they call an in-network provider. They are your contracted doctors, hospitals, whereas the insurance carrier will pay benefits at a predetermined and yet maximum rate. Your out-of-network providers are all the other doctors and hospitals that are out there. Benefits will be paid, but if you use an out-of-network physician or hospital, it is paid at a much lower rate. Remember, no matter what, the contract is with you and the insurance company. It is your responsibility to pay what the insurance company does not. So you need to find out in advance, especially for surgical treatments, what you're going to be charged. There are some standard terms that you need to also understand so you don't get caught with unexpected charges or things that you didn't get authorized. The first term is pre-certification. This usually refers to an overnight stay in the hospital. So if your child is having a laser procedure and that for some reason they need to stay more than 23 hours in the hospital, generally pre-certification is necessary. But if they're not staying more than 23 hours, then that's considered an outpatient procedure, and most insurance companies don't require pre-certification. Which brings us to prior authorization or pre-approval. This actually refers to the procedure or the surgery itself, and you must get prior approval before the procedure date. Each insurance company differs on how to get that approval. Ideally, your physician's office will call, submit the information, and either right there over the phone they will give you the authorization, or you'll get it in the next few days. Getting prior approval is your only guarantee that you're going to have benefits for those procedures. Without this, again, the insurance company doesn't have to pay. You also have the right to request what we know as a predetermination of benefits. That is exactly what the insurance company will pay for a given code, procedure code, and what they are authorizing. This summer, my daughter had some oral surgery. We had our doctor's appointment, we had our evaluation. We then went into a benefits office where they picked up the phone, they called my dental insurance on the phone, and we knew right then and there exactly what the insurance company was going to pay, what we were going to pay, and what reduced rate because we were in a participating in-network plan. But getting those maximum benefits for your policy is not always as easy as what we went through. It seems to be that dental insurance works a little bit easier than our regular health care plans. So you want to do the things that are going to allow you to get your maximum benefits. In the case of PHACE, there is usually an underlying medical concern other than the vascular lesion, and the other symptoms beyond the vascular lesion generally creates medical necessity, which will allow you to see a specialist. Unfortunately, that does not mean you get a free pass for the treatment of everything. And so you may have to go through an appeal process and work your way through the system for some of the treatment that's necessary. So we recommend that you keep a journal of all the medical issues related to PHACE. Now this will help you with both remembering everything so that at those doctor's appointments you can communicate well to your physicians what's going on with your child, because there's lots going on. And so you want to make sure you're keeping track of it on a day-to-day basis. So we tell our families to include photographs of the hemangioma, especially in those early weeks when it's growing rather rapidly and there's lots of changes. Include your medications, the doses, how well they tolerate the medication. Are there mood changes, bowel habit changes? Are there skin changes? Make note and take photographs of if and when an ulceration appears. But also, for the insurance company, you want to include those out-of-pocket expenses. So if you're needing to buy, bandages and dressings for an ulceration, you want to keep track of what those costs were, because you can use them to justify other treatment down the road that you might need to for an appeal process. Keep a record of every doctor's appointment you've been to. If you're seeing 4 or 5 physicians for a variety of things, date them and fill in the information that was gotten out of those appointments. These journals will be critical to ensuring that you're communicating with your physicians and your insurance companies. Whether the diagnosis of PHACE was made at birth or right after birth in the hospital, or it was made incrementally as certain things started to develop over the first weeks of life, you want to make sure that you are being managed by physicians that are experienced in this field. Your insurance company will require a referral to either a vascular anomaly center or a single specialist. So doing all of these things will help make that happen. So, there we go. So the referral that your primary care physician is going to request often requires a referral letter from the primary care doctor to the specialist. Getting those maximum benefits will rely on that referral letter. So if your PCP or primary care physician is making the referral, it should include a request to make and or confirm a diagnosis. It should clearly state that the referral is medically necessary, listing the medical reasons why a specialist needs to be called in. It should state that the patient needs an evaluation and request that any required treatment be allowed. Sometimes the insurance company will allow for an initial evaluation, but they will not authorize treatment. It's best when they authorize both, but as they tighten their strings, they don't always do that. So what you're going to need to do is when you get to the specialist, they then have to call to get treatments authorized. Requests for treatment should include phrases that indicate that the treatment or procedure, if it's surgical, are for reconstructive reasons. Now the AMA has defined reconstruction as any procedure performed on abnormal structures of the body caused by congenital defects. Such procedures should be performed and allowed to improve function and to approximate a normal appearance. Now that's the AMA's position. Most states have enacted laws because insurance companies didn't want to comply with that. So most of the states individually have enacted laws that pretty much force insurance companies to allow benefits to cover the diagnosis and treatment of all congenital or developmental deformities, diseases, or injury to a minor child. So that includes all of our children here today. This referral can also indicate that there are no local or other in-network doctors with the experience to manage the comprehensive care of PHACE. So that letter that goes to your insurance company for that referral is really important, that it's well worded and well put together. And we've seen them where they've been, generally for PHACE, there's something that they're going to allow, but it's when you want to go and do some other things that this referral is so important. Unfortunately, despite your best efforts, your insurance company may deny at least some part of your request. So when it comes to the denial, you have some things that you can do. And I would suggest that you actually pick up the phone and speak with a case representative and ask them to provide you with a written explanation as to why and what is being denied. Every insurance company has an appeal process that you can use, but each one, of course, is different. So when you speak to the insurance company, have them send you, or a lot of them have them now on their websites, that you can go to and find out what is their actual appeal process. Every time you speak to somebody at that insurance company, whether it's for a lengthy conversation or just a quick question, please take down their name, record the time that the conversation occurred, and make notes of exactly what that was about. You can also try to deal with the same person. Sometimes you can get that. My husband's company, whose our insurance is through, actually has a designated line for just his company. And so we have a better chance of getting the same person when we call and we request them. But if you don't have that, you might not have a designated line, but you still might be able to request a certain person. Now, it may sound cliche, but you do get more bees with honey than you do vinegar. So be nice, try and get them on your side, be sympathetic, have your baby crying in the background. All of these things are helpful. They are people, lots of times they're parents too. I know with my daughter, when I finally was able to send some pictures and I got that same person back on the line, she was very helpful. She had a totally different attitude. But again, they still will deny you benefits at times. And one of the reasons that they will give you is, and I'm going to quote this, the benefits are denied because comparable services were available within your network. Sounds very good, but basically what they're telling you is they want you to use their guy. They want you to see the doctor that they have networked with. And for a lot of things, that's okay. But for this early stages especially, and the highly specialized nature of PHACE, you really do need to see those physicians that understand the complexity of this disease. So you're going to need your general practitioner, your pediatrician, your family practice doctor to really work with you and help you to get this appeal process going. Unfortunately, the burden of the appeal will be on you as the parent. You're going to have to put all this together, and I've talked with parents that have told me it's taken them hours, days and days of hours to put things together. The good news is generally speaking, if you're willing to fight it, you're going to get it covered. That's where the journal comes in. So you kind of organize that journal, get it typed up, and you include that in your letter of appeal. Another thing that you can do is contact, each state has an insurance commissioner, a health insurance commissioner. Contact your health insurance commissioner and find out what your rights are in your state, because they do differ from state to state. And so then the next conversation you have with your insurance company, you tell them, I've spoken to the insurance commissioner. They don't like that. They don't want complaints filed against them. It often is what gets them a little bit more motivated to kind of help you and get your coverage. Again, be nice, but just kind of let it slip out that you've done that. But your insurance commissioner can also tell you, have there been complaints against your carrier? And if they are, then they're going to ask you more questions about, well, what are they denying for you? So, there's a whole lot of things you can do to put in this appeal process that you're going to go through. And a well-worded appeal often gets you the coverage that's necessary. Now, right now, probably one of the biggest questions I'm getting when it comes to insurance is, how in the United States is health insurance reform going to affect my child with PHACE? That answer is I don't know. I can say that effective September 23rd, so just next week, the no pre-existing condition exclusion goes into effect for children. So you no longer have to worry about, if you change jobs, will my child be covered? You can, effective the 23rd, for all pediatric patients, you can change insurance and they can't exclude you from your pre-existing conditions. Nor can they, within a policy, start to exclude you because you're using your benefits too much for pre-existing conditions. So Now adults, unfortunately, that's not till January 2014, and that's so far away we don't even know if that will really go into effect then or not. But for the children, that does go into effect. All of what I said, we do have in a guide that if you just email me, I can get that to you. We have it in print, and we are updating it as all of the health reform effects take place. I also, as we saw today, there's really not much more than I can say than what you witnessed. But families helping families is so important. You all bring to the table the common experience of having a child with PHACE, and this experience, the most experienced medical teams can't share with you what your other families can in the areas of what they've been through every single day. So I really encourage you to go and connect tonight at the dinner, and do it online, but connect with the other families. You'll be able to share tips and suggestions for very common things that happen, like my child keeps vomiting when they're with the steroid, and how do I get them to sleep without spitting up? And there's just little things that they'll be able to share that have worked for them. They also give you really big shoulders to lean on. I know even for me, going back 16 years now, being able to pick up the phone and call another mom who had a child with a similar hemangioma and kind of rant and rage and cry on her shoulder was very important. So I encourage you to do that, and don't be afraid, because these shoulders, for all these parents that are down the road ahead of you, they want to help. And in doing that, I promise, you're going to create friendships that are going to last you an absolute lifetime. And if things are, crazy and hectic right now when they're little, but down the road you'll still have these friends that you've met here at this conference and through networking on the internet. So I want to thank you all for allowing me to come and kind of be your patient advocate here today. I want to thank Beth and Children's Hospital of Wisconsin for bringing NOVA on board and making us a part of this wonderful event. The Hague Group for all the work that you guys have done over the years, because I kind of feel like I've kind of watched the whole transition of this, and pulling the families as part of this is so important. So I thank you all for including the families and us in your medical meetings and your research. And I want to thank all of you here, all of you parents, because you give us so much back. I know we give you information, but I can't even begin to explain the blessings that I personally, and I know our board of directors, Roy and Denise Adams, and the other board members receive from each of you, just having you touch our lives. So I thank you all. Looking forward to seeing you all at dinner, and have a great rest of our meeting.